Hello, my name is Ezekiel Ray, and today I will be giving a presentation on the topic I had chose for my final project. I had chose PTSD, and looking specifically at the causes, treatment, and prevention for post-traumatic stress disorder. I'm going to go over what PTSD is, the impact on specific population, prevention and treatments, and then wrap up with a conclusion. Now, the question is, what is PTSD? It is an acronym for post traumatic stress disorder. The Mayo Clinic defines it as a mental health condition caused by extremely stressful or terrifying events. Um, and symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts. And one of the things that distinguish post-traumatic stress disorder from regular stress or acute stress is while most people improve with time and self-care, if symptoms worsen and affect daily life for months or years, it may be PTSD. Now, PTSD is nothing new under the sun. It probably has existed since the beginning of time. It was known by some other names historically. Some you may have heard before if you read history books or watch the History Channel with World War II or World War One or things before that. Some common names for PTSD were shell shock, soldier's heart, combat fatigue, and war zone exposure. And you would notice a lot of these have a correlation to do with war and combat. And as we know, even for our veterans today, PTSD is a big issue because you have them going to war and seeing war while their brains are still under development. Because often, people are between 18 and 22 when they join the military and go overseas to fight war, experience some pretty traumatic events, especially involving death and um, their lives being nearly taken if they make it. Now, there's also some common misconceptions about PTSD. It's often used colloquially to describe anxiety or stress. So you hear people like, "Oh man, I hate going to that store. It gives me such PTSD," or "Oh man, I don't want to swim in that swimming pool. I got PTSD from the last time that kid dropped ice cream on me in the pool." And those true things are not PTSD, but in a sense they're described as something that gives you anxiety or stress by way of a previous um, situation. Now, the truth of that matter is, it might be PTSD, but there's some other factors that have to be at play for that to be true. Because we all deal with stress and trauma, but not all of it lead to PTSD. Um, if you have a prolonged inability to cope with the trauma, that might be PTSD. If it's affecting your daily life and normal functioning, that might be PTSD. Different people react differently to traumatic experiences. 5 or 10 people can witness the same traumatic or deal with the same traumatic experience, and all 10 of them can have completely different interactions. And a lot of that have to do, as you will see later in the slides, has to do with people's experiences in their upbringing and what they've already been exposed to. So, who's at risk? The truth of the matter is, PTSD affects all demographics. It doesn't discriminate based on gender, race, ethnicity, or socioeconomic status. It affects all walks of life. However, there are subsets and groups of people who are at more of a higher propensity of developing PTSD than others. Some of those susceptibility factors are age of exposure. Um, the younger you are, the more toll traumatic experiences can have on you. The types of exposures, is it those big T's or little T's that are going on? And the quantity of exposures, again, is the quantity of big T's or little T's going on um, going to have an effect on your ability to cope. Some other demographics that are more susceptible to PTSD are some occupations. Um, and some of those include police officers and firefighters and paramedics, medical and healthcare workers and correction workers and military service members. Again, all of these have to do somewhat with death or dealing with difficult situation or traumatic experiences. And I think also the rate of exposure compared to other people, right? Because in a lot of these first responders or even second responders, if you think about healthcare, um, they having to deal probably with death or very traumatic events on a daily basis, while the normal person, if their job doesn't involve that, they're probably not going to have as many exposures. And then there's also some other high risk people that has nothing to do with occupation, but more so where you live, socioeconomic status can have a play in that. Age, as we talked about, adolescence. There were some studies that shown those between 10 and 22 deal or are exposed to more trauma than other age groups and also are more risk of developing PTSD because of that. And female adolescents are actually twice as more likely to develop PTSD than their male counterparts. Um, and then also it comes to for those living in violent neighborhoods, especially minority females living in violent neighborhoods more so than their other counterparts, is just dealing with violence or being a victim of violence on a daily basis or a common occurrence can take a toll on the psyche. And something that comes along with PTSD as well is usually PTSD may not be the only thing as a provider that you may be dealing with or a client may be dealing with. They may also have a substance abuse disorder. Literature shows that there's a significant link between PTSD and substance abuse disorder. Um, there's also some neurobiological pathways common to both disorders. And as we know, based on reading Dr. Claudia Black's work, that there's a strong correlation between trauma and addiction, and also trauma, addiction, and mental health. And the commonality between all of those is precept on the fact that it all derives from trauma. And we know also there's a heavy impact on those in childhood when you look at the ACE questionnaire and the detrimental effects that trauma do have on children and how it affects their outlook on life. And so, why is this important to our profession? I think it's important for us to understand who might be dealing with PTSD, which is everyone, but who might be more susceptible to it. Um, so we understand that we're going to be dealing with people from diverse backgrounds and socioeconomic status, and we want to be culturally competent and recognize the impact that it may have on some people who may live in poor, violent neighborhoods, certain occupations, who are, maybe female and ethnic minority, who may be adolescent, and those at higher risk. So, as a professional, we want to make sure we're providing the best help we can to someone. So, it's very important that we, as professionals, understand what PTSD, what co-disorders can look like, and how we can try to help treat them. And also that the fact that there may be some challenges in treatment. PTSD obviously is a mental health diagnosis developed from trauma, and trauma and mental health issues, as we know by Dr. Black's work, are closely related. Um, and PTSD and SUDS can co-occur in people. And early childhood trauma actually can lead to an early onset of substance abuse. There's an increased risk of depression, anxiety, and suicidality for those with PTSD, and substance use is used as a coping mechanism. And people may not disclose that they have a substance abuse disorder if they come to you for PTSD alone, and that's something that can be very crucial to make sure you're effectively treating someone for PTSD is knowing if they have a co-occurring disorder. Now, also with that being said, suicide is an issue when it comes to PTSD. It's the, you know, ultimate severe consequence of PTSD being untreated. There's an increased prevalence of suicide attempts among adolescents with PTSD. The general population as a whole has seen a rise in suicide rates over the past 20 years, and veterans have experienced a greater per capita increase in suicide over that same time period. So, a study looked at veterans with mental health or substance abuse disorders are twice as likely to die by suicide. In 2022 alone, 1,548 veterans died by suicide. 64% of them were diagnosed with depression, 43% with anxiety, 40% with PTSD, and 32% with alcohol use disorder. So, what are some therapeutic approaches that we can take? There's cognitive behavioral therapy, cognitive processing therapy, prolonged exposure therapy, and pharmaceuticals for anxiety and depression and other things. And there's also some other modalities that you can use, like EMDR and some other ones out there as well. Um, so this brings us to the next point. Okay, we know what PTSD, what causes it, some treatment modalities. How do you prevent it from beginning in the first place? And there's some strong evidence out there, some empirical proof out there that supports that resilience can improve the chances of people not even developing PTSD. Having a good, strong social network is correlated with having very good resilience. There was a study done that looked at African Americans and Caucasians in America, and it showed that African Americans had a lower depression rate than their white counterparts, although they dealt with more trauma. Um, and a lot of it had to do with African Americans being more church going and having support from a church and having strong support from people who were not family, but they were seen as family. And when you have a strong network, it leads to greater resilience. And that's true across all demographics, no matter socioeconomic status or race. And with that, another study showed that resilient veterans with strong social support show low psychological distress, while non-resilient veterans without social support showed high psychological distress. And both of these group of veterans had been exposed to a high level of trauma. So it just shows like the importance that resilience has in not developing not only PTSD but probably a lot of other issues. Um, and it also has been shown that resilient families obviously produce resilient individuals when they raise children. So, in conclusion, trauma is an unavoidable presence. We know is an inevitable part of life. Preventing and treating trauma is very important and can impact future generations. Now, one thing that still needs to be done is we need to research PTSD. We need to explore prevention, treatment, and recognition of it. We need to further research due to rising PTSD cases and suicide as well. Um, it's also one of those things, can we have better early intervention so people who are dealing with trauma or an acute trauma experience doesn't develop PTSD? We know that there's certain psychotherapy modalities that exist for treatment. Some other ones we know as well. We know there are certain subgroups that are high risk, and we also understand the importance that resilience and supportive social network plays into that. So my hope is that one day, with all of this information, and as we study and we look at more into PTSD and how it has affected um, not only our nation but just individual to individual and probably the world over, if there's a way we could come together and create more resilient people and also create a situation in an environment in which PTSD can become something of the past. Again, my name is Ezekiel Ray, and thank you for listening to my presentation.